Anyway, does President Obama want a single-payer universal health plan that eliminates employer coverage? The president, in his own words.
I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
I happen to be a proponent of a single-payer universal health care plan. A single-payer health care plan, universal health care plan. That's what I'd like to see.
So will the president get the plan he wants? Joins live with Senator Jim DeMint, author of the book Saving Freedom, We Can Stop America's Slide into Socialism. Now, those were rough videos. I don't know if there's some video out there where it shows everyone singing praises of the plan, but that was raw.
I want to thank all the American people who are going out, showing up at these town halls and these meetings to let congressmen and senators know what they think, because I know they're outraged. And Mike Huckabee was right. I've never seen people more panicked about what we're doing here in Washington.
But the issue even like of the health care, like whether there should be a single payer or not.
Right.
I guess what, listening to those clips from the president, the question, we really should know, what does the president want? He has said that he wants single payer. It's a good idea. I don't know, but that's not what he's pushing right now.
Well, no, he's covering it up. I mean, it's clear that he wants a government-run single payer system. Charlie Rangel is on record wanting a government system. Barney Franks. So people should not be confused. What we're talking about here is not fixing health care or not fixing health insurance. It's a government-run system. For years, I know I and a number of Republicans have been working on reforms to make health insurance work better, make it cost less, but we can't even get the Democrats to talk to us about making the system work better.
In terms of health care, you agree that there's got to be something done to it.
Oh yeah, and I've got a bill I think that would do a lot to make it work.
Like what?
Well, this bill would first of all give people fair tax treatment. If you get your insurance at work, you get big tax breaks. We could give every family in America who don't get their insurance at work $5,000 a year to buy their health insurance. The average cost of an individual family policy is $4,400. We could do that, and we could do it just by using the TARP money as it comes back in. No new spending. The other thing we need...
So that helps the family who isn't as lucky to work for... Like, I work for a big corporation, so I get health insurance. So someone who has a mom-pop store or something who can't do it, they get a deduction. They get the same thing I get.
That's a lot of the uninsured. But the other problem is cost. Right now, the federal government doesn't allow interstate competition between insurance companies. If I'm in South Carolina, I have to buy from a company that is registered there, instead of letting me buy somewhere else where it's cheaper or a better product.
How do we know we're not going to get gouged by the insurance companies? I mean, we see, we've seen Wall Street where the CEOs make a bloody fortune, some of them, not all of them. How do we know that's not going to happen?
If we made them compete, if there were dozens of companies competing for my business instead of 2 or 3, we could have a lot more transparency, a lot lower costs, and every state regulates their insurance market, so it's not like we're letting them operate without regulation. But we would make them a lot more accountable if we had a national health insurance market rather than state-by-state monopolies. We could fix some the high risk or the pre-existing conditions that people have. My bill provides $25 billion to states to set up a system so that if you have a high-risk condition and you're uninsurable, you can get affordable policy. If we would just do those 3 things, Greta, we could get most of the uninsured insured. Heritage said my plan would get 23 million insured within the next 5 years.
All right, well, you got like 4 weeks to convince the American people before all of you come back to work. So good luck, Senator.
Thanks a lot, Greta.